Hey, 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 it's Dr. Tamara Beckford with Your Caring Dogs. That's right, where we help you with health, medical, and wellness info, all coming from doctors. And we have a special segment, which is Your Caring Dogs, Dogs Who Care. Today, we have the one and only Dr. Rebecca Berens, right? So with our Dogs Who Care segment, we have doctors who come and help us with health, wellness information. These are doctors from all over the world. Dr. Berens is here from the H-Town. Okay, that's right. Dr. Berens is a Houstonian where she went to school at the Baylor College of Medicine, and then she did her family medicine residency in DC. After DC, she went to Philly. She helped those out in Philly, but then she decided to bring her talents right back here to Houston, where she has the Vita family practice. Now, Dr. Berens also loves to help women, especially those within the fourth trimester, and helping those women as a lactation specialist, right? She's going to tell us all about that today. We're so excited to have Dr. Rebecca Berens. Hey, Dr. Berens, how are you?
I'm great. Thank you. Thank you so much for having me. I appreciate it.
Hey, it is all our pleasure. Thank you for coming on. So I gave a little bit of background, but you go ahead, tell us more about yourself.
Yeah, so I grew up just outside of Houston in Richmond, Texas. And I'm, like you said, I've been a Houstonian since, well, actually, I moved here from Scotland when I was 9, but I've been in Houston for a long time. And I was really excited to come back after my husband finished his residency in Philly and come home and be near family and back in the city I love. So, yeah.
Wonderful. So now we're talking about the fourth trimester. A lot of people, some might have heard about it, others are like, that makes no sense. Just the word trimester, for all our linguists out there who's just going to sit and start teasing apart that word. Trimester means 3. Why are we talking about the fourth? So go ahead and explain and inform us about what the fourth trimester entails.
Sure. So most people are familiar with the 3 trimesters of pregnancy, which is where the term trimester came from. So you have your first, second, and third trimester. The fourth trimester is the 3 months after the baby is delivered. And the reason that we kind of refer to it still as a trimester, it's still a time where mom and baby are very intricately connected, just like they are when baby is in the womb. And they still are very much dependent on each other and very, very hormonally connected to each other. And so we have to consider both of them whenever we're caring for one or the other during that time period because they're so closely connected.
So with this trimester portion, right, like a big portion of it is breastfeeding and lactation. Now let's talk about how you help and support women who are breastfeeding and as a specialist in breastfeeding.
Sure. So yeah, I mean, a lot of the initial challenges in the fourth trimester are breastfeeding related. There are a lot of other challenges as well, but that's a common one that's commonly discussed. Difficult experience in the fourth trimester with initiating breastfeeding with my son. I thought I was all prepared because I was a doctor and I thought I knew what I was doing, but as I learned, you really have no idea until you try to do it. So I had a really tough time after he was delivered. He did briefly go to the NICU, so I had to, kind of learn how to stimulate breastfeeding on my own before I was able to be reunited with him. And then just kind of navigating those first early weeks as I and he were trying to figure out breastfeeding. So that's kind of how I got interested in it. I decided to pursue additional education on top of my medical education in becoming a lactation consultant. So I became an international board certified lactation consultant in addition to my MD. And that allows me to kind of approach each parent and baby pair from both sides. So from my medical side and then also from the lactation support side. So when I have a new family that's having struggles with breastfeeding, I'm able to help them with initial latching and techniques to help get a good latch, any breastfeeding difficulties like plugged ducts, mastitis, and then I'm also able to medically treat them for that as well. So not just the lactation support portion, but also the medical treatment if there is a medical complication that they're experiencing.
So let us know, based on your experience, what are some of the wins that you've seen in these women whom, your lactation, breastfeeding, it's supposed to be quote unquote so natural, right? But yet, exactly, it's not. Everyone says that, oh, once you have the baby will just automatically latch and then you're going to have this great bonding period. But what about the women that you've seen who it was just not so simple, but then through your help you were able to help them to get through those periods? Tell us some stories.
Yeah. So, I mean, people always say that, right? That it's natural. And people think that means it's easy. Maybe back in the day when we all lived in villages and we all observed people breastfeeding all the time and had a supportive community around us who was very knowledgeable about breastfeeding, helping us all the time, maybe it was easier then. But nowadays we're all kind of siloed in our own homes. We don't have support around us like we used to. So it's definitely not easy. And, I've seen clients with a lot of different challenges, from low milk supply, not able to produce enough milk, or painful breastfeeding, difficult latch. And I think not always am I able to completely 100% fix the problem, especially with people dealing with low milk supply. I can't always help you get a full milk supply. It's not always possible. There's medical reasons why that's not the case for some patients. But I think what I'm able to help with the most is, kind of helping you navigate that experience and get the best relationship out of it that you can. And, if there's something simple I can do to help make a latch more comfortable and, it goes from a terrible experience to a perfect experience, that's great. But even if I can't, I can help you normalize what you're going through and get the best experience out of it as you can. And that's really what I love to do, because, there's not every case that we can 100% fix it, but at least we can support you through it emotionally and physically, and help you enjoy that bonding experience with your baby.
Absolutely, absolutely. So you and I have spoken a little bit off camera, and I did relay that I myself had issues with the breastfeeding process. Now let's talk about those women, and you mentioned it a little bit yourself, who have babies, who they're born prematurely. So the babies are in the NICU, which was one of the issues that I had, right? So the stimulation, it's not there. You're still trying to use artificial means, which is the infamous breast pump, to get to the stimulation, but you're still not getting that there. What are some of the advice that we have for these women in letting them know, and the comfort, like it's okay? What is it that you tell to these women?
Yeah. So, I mean, that can be such a traumatizing experience. And I really encourage anyone who's interested in breastfeeding and wants to breastfeed their child to have a prenatal consultation with a lactation consultant or a doctor who's a lactation specialist, because they can help you look at your overall health history and your specific situation and give you specific tips to be helpful to you in preparing for that, should that happen. But what I try to encourage people is to make sure they understand that breast emptying and stimulation is really, really important in those early stages, and to try to get that done at least within 6 hours of delivery, if medically possible, but if not, as soon as it's medically possible. And hand expression early on can be much more effective than the breast pump. So I usually encourage attempting to hand express some colostrum first, because that doesn't come out as easily into the pump, and then pumping after that. And that just additional stimulation is really helpful for bringing in that initial milk supply. Skin to skin contact with the baby is also really important for establishing your milk supply. It's not always possible when the baby's in the NICU. Sometimes you can't even see the baby depending on the medical situation. But if you can get skin to skin contact, that is really important. And if you can't, just a picture of the baby, just looking at the baby, or an item of clothing that the baby was wearing, like a hat or something like that they put on the baby, just having the smell. Anything you can do to simulate that bond of closeness that skin to skin would have is really, really helpful.
So I think that you just hit upon a very important portion that I don't think the average person recognizes, which is that hormonal bond between mom and baby. So as you mentioned, even something as simple as just looking at the picture of the baby, it helps to stimulate. And you said even just getting an item of clothing and smelling that, Like, that's how intricate our bodies are in wanting to stimulate and to bring forth this milk. And in addition, you said that if you're unable to initially use the breast pump, expressing hand expression is something that's important. I don't really know how much we have emphasized any of this within the non-medical community. And so I really want us to really emphasize, like, those little tips can help you, especially during those first few hours after delivery. If you're unable to be with your baby physically, these small tips can help you to produce that milk that you want. As I would say that those are great tips. I know for I myself, when my son was in the NICU, he was in the NICU, I think for probably maybe like 2 or so weeks. And I was able to see him probably, I think mine might have been a little bit after 6 hours after delivery. And, I had a challenging experience with breastfeeding. And that's why it's so important to hear this from you, from the lactation specialist, because if I, as a physician, had this, you can imagine how many women who are non-medical inclined who are having the same thing and having this guilt, right? So what do we say to the women who are having this guilt and they're saying, well, I should be able to breastfeed. I don't understand. Such and such person has, and this is just real talk, this person is a smaller chest size than I am. I'm a large chest size. I should automatically be able to produce tons and tons of milk because my chest and my breast size is large. Let's talk to these women and let them know.
Yeah, so that's a huge misconception. Yeah, breast size has absolutely nothing to do with milk production capacity. Breast size is primarily determined by fat deposit size, not glandular tissue size, and the glandular tissue is what produces the milk. So yeah, I mean, there's so much guilt around breastfeeding and around, I mean, pretty much everything about being a mom, there's guilt. There's someone out there to guilt you about it. And I always tell people, you are doing the best that you can, and you're doing the right thing for you and your baby. The most important thing for a healthy baby is a healthy mom and a healthy dad, healthy parents. So, if something goes wrong with breastfeeding, you're not able to breastfeed for whatever reason, that is not the end of the world. You are doing the best that you can. But if that's something that someone feels very strongly about, I want to be able to support them in any way that I can. But it's, there's not enough education out there. There's not enough support out there. And so there's a lot of people who, because of that, are not able to meet their breastfeeding goal. And that should not be something that anyone feels guilty about. Happy, healthy parents, happy, healthy baby is the most important thing.
Absolutely. So are there any tips for those who are breastfeeding or the support system that they have around them to help moms to be the best they can during that time?
Yeah, I mean, I think I always encourage people to make a plan for how they're going to have support after baby's born. I think a lot of people plan, what they're packing in their hospital bag. A lot of people plan what kind of birth they want, which, you can plan and plan and plan, but the birth is going to happen how it's going to happen. It's more important to me to plan your support system. So, who's going to be at home with you helping, take care of other kids if you have them, take care of household tasks so that you're not trying to do that postpartum or potentially post major surgery if you have to have a C-section. People can plan meal trains to drop off food for you. People can, drop off coffee or breakfast for you in the morning. They can come by and clean your house. They can come by and help you with laundry. You should not have to worry about those things in those early days. In a lot of cultures, the first 40 days, the mom and baby just sit together in the bed and all they do is, snuggle and breastfeed, and that's it. And everything else is taken care of. That should be your goal, is to find the community around you to take care of everything else. And you just focus on taking care of yourself and the baby.
Wonderful, wonderful. Okay, so let us know, talk to us about your practice, Vita Family Practice.
Yeah, so I started my practice in January of 2020, which is, an interesting time to start a practice. But really, my goal in starting the practice was I wanted to have a place where the whole family could be taken care of from birth till the elderly age. And so I love to take care of new families with newborns, but also, older families with older kids. And as the family grows, I want to grow with them. And so that's kind of how my practice is focused. I do specialize in lactation support and newborn care, but I take care of people of all ages. And I really enjoy primary care, which to me means, I'm the first point of contact for any health concern, so that I can help to guide you so that you're not, going to the ER unnecessarily, having unnecessary testing done, wasting your money in a lot of expensive healthcare places, on unnecessary medications. I want to help prevent health problems and keep you out of those higher healthcare classes, I guess, like the ER, to help you take good care of yourself and save yourself some money.
Absolutely. So before we go, I do want to know, are you taking on new patients?
I am currently accepting new patients for both lactation support and for general primary care.
Okay, good. All righty, so we have a fun question before you give us all of your info of how we can find you. So if you were not doing medicine, what would you be doing? Either that, or you can tell us a fun fact about yourself.
So I really enjoy sewing. I make my own clothes. I don't do it very often now because, I have 2 kids and a practice, so I don't have a lot of free time. But when I did have free time, that was like one of my favorite things to do. So I think that's what I would do if I was not in medicine. I would like to make clothes and maybe start designing patterns and things like that, sewing patterns. So that's my fun activity that I do in the evenings when I have a little extra free time.
Oh, awesome. Wow. I wish I had that skill set. I don't, but it's one of those skills that I wish I did have. So thank you so much. All right, so Dr. Berens, let us know, where can we find you?
Yeah, so my website is www.vitafamilydpc.com. And I am on Instagram and Facebook at Vita Family Medicine.
All righty. So that's Vida Family Medicine. That's VIDA Family Medicine. All righty. So Dr. Berens is one of our docs who care. I am Dr. Tamara Beckford with Your Caring Docs. So you found the scoop about lactation, why it's important, how the support of those who are going through that 4th trimester, how to support them, and to make sure that they have a healthy family, healthy mom, healthy baby. That's the motto. I'm Dr. Tamara Beckford with Your Caring Docs. We look forward to seeing you next time.